videos. Yeah. So that I can interact with you, I can see your faces. Yes, good morning, Monica. Good morning, all. With all your permission, let us continue with the ongoing study. So we have been reading Dr. Vijay Kasar's book, that is Theory of Suppression. And now we have reached the study of cases, where Vijay Kasar has given a lot of examples of cases. So welcome you all once again to our reading of this book, Theory of Suppression. So let us go straight into the case. In our last class, we have been dealing with a child of 4.5 years, and it was a case of chronic cough. It was a case of very violent cough. Violence means what? Syphilitic. Yes. Are you all there? So now we go straight into the case that it is page number 102, okay? So where we stopped, we had a small discussion about croup. When we talked about croup, we had a small discussion about croup, that is laryngotracheobronchitis. And then we compared it with stridor. That was a high-pitched sound, no? Especially during inspiration. Yes. And then the wheeze. Wheeze will be the high-pitched sound will be released during the expiration. And whooping cough, that is an infectious cough, that is because of that Bordetella pertussis bacteria. And the continuous incessant cough will be there. At the end of the cough, it was a breathless kind of cough, and then there will be a sudden inspiration with a whooping sound. So that is called the whooping cough. So now, so after these comparisons, let us go straight into this sentence. This spasmodic cough or croup was sometimes associated with sudden. Sudden means what? Syphilitic miasm. Unexpected. Unexpected means what? Again, syphilitic miasm. Unexpected rise of temperature coming on at night. At night means what? Syphilitic miasm. So this child, the predominant miasm for this child is nothing but syphilitic. And the appetite has reduced over last 1 year or so, and he had lost weight drastically. So this losing weight drastically with unhealthiness, okay? That is again syphilitic miasm, right? Another physical complaint which had started after the vaccination was loose stools with very offensive flatus and loss of appetite. Voice was hoarse or heavy. So this much is the presenting complaint, guys. Now we are going into the nature of the child. We want to know what is the nature of the child. So this is very interesting. This child loves to play in mud and dirt. Now come on. How many of our children loves to play in mud and dirt? Of course, all the children will have a little bit of tendency to play in sand. Yes, in the play areas where the sand is there, every children is attracted by the ground, by the earth, by Mother Earth, by sand. But then what we will say? We will advise them, oh, don't play in sand. Or, okay, after that you come and wash your hands. But this is adamancy. And see the next sentence. Loves to play in mud and dirt, can do anything in mud, likes to roll and crawl and play in muddy water when he is very happy, or even rolls obstinately in muddy floor when he lost his temper. Which miasm? Is it Sora? Is it Sora? Which miasm? Are you there? Give me some indications, no? Monica, Arati. Yes, syphilitic miasm, right? Yes, syphilitic miasm.
Oh.
Yes. Yeah. You can keep your audio in mute.
All the best.
So that the class will be uninterrupted. Yes, thank you, doctor. So now he throws temper tantrums and rolls on the floor. Okay. So coming to this rolling on the floor. Rolling on the floor. Which are the medicines which have this rolling on the floor or rolling? Rolling, because rolling can be due to many things, no? Heliborus will roll his head into the pillow, right? And Epis, due to severe pain of the hydrocephalus, it can also roll from side to side, no? Belladonna, yes. So there is a rubric called anguish. Yes, tarantula, tuberculinum, very good. Calcarea. In bed, If a patient is rolling because of anguish, what is the remedy? Interesting rubrics in our repertory, guys. So this habit has to be inculcated, like looking at the repertory. When you get the word, you search in the repertory. What are all the other medicines? And what are all the scenario where you have to roll? You can roll because of anger, because of obstinacy, because of fear, anxiety, anguish also. Anguish in the bed. Yes, in meningitis, in different conditions. Even in asthma, you can roll because of that anguish. Or if there is no physical condition also, because of some mental thing, you can roll if you're having the anguish. So anguish in bed, which is the remedy? Which is the highest medicine coming to your mind? The most commonly used medicine coming to your mind with for anguish. Arsal? Yes. Arsal, yes. Monica. Yes, Divya. So Arsal was that remedy. So there's only a single remedy. So anguish means it is the height of anxiety. That is a syphilitic miasm. So it is very important in patients who are presenting with so much of syphilitic anguishness. Then there is another rubric called delirium rolling on the floor. Delirium rolling on the floor. As you said, very nicely said. Calcarea carp. Many of you have said calcarea. Then opium is there. Delirium rolling on the floor. Rolling on the floor means which medicine come to your mind? Dirt, rolling on the dirt, rolling on the floor, rolling on muddy water, a dirty remedy, chamomilla, sina and all is there. But then another medicine is also there, no? Sulfur. Yes, dirty, rolling on the floor. Sulfur is there. Arsalb is there. Can you imagine arsalb and sulfur poles apart they are? Arsalb is the gold-headed cane. It is the most fastidious thing in Ametria Medica. And still arsalb can floor on the ground, can roll on the floor. Arsalb is there, acetic acid is there, cicuta, proteus, tarantula. Yes, we have forgotten about tarantula. Tarantula is another great remedy which rolls on the floor, right? Especially in children. Then there are certain remedies which will roll after having a goose. Yes, delirium tremens, delirium tremens, Merck. Yes, Suresh is saying Merck. Yeah, for delirium tremens, it is stramonium. Delirium tremens, and in the bed, they roll from side to side. After full drunk, they are rolling from side to side. That is stramonium. Then there is another rolling remedy, rolling rubric regarding the rolling, that is rolls in his filth. In his own filth, he will roll. Yeah, camphor is the remedy. Camphor, rolling in his own filth. And sometimes, no, like to the other extent that swallowing his own filth, swallowing his own feces. That you all know, na? Veratrum, very good. Veratrum, medorinum, and Merck are also there. Merck is also a great rolling remedy. Yes. So this child is also really syphilitic remedy. Syphilitic child, he wants to roll on the floor whenever he is angry. And whenever he sits on a seat, he involuntarily falls down onto the floor. So floor is his basic fantastic position. No, he needs to roll on the floor. He is very shabby and dirty. Any good clothes he wears, after a few minutes, you will find the clothes dirtied. So what is that? So it is perverted and destructive syphilitic mentality. No doubt about that, right? Anger. Coming to the anger was very violent, and so was his love. Besides rolling on the floors, his anger would make him kill insects ruthlessly, or tear or throw away a book and valuable things. Yes. Due to anger, he will go and kill the insects. Which are the remedies coming to your mind? Killing insects. Come on. Let us rack our brain. Get a revision of all the Metra Medica. Tuberculinum, yes. Tarantula. Anacardium, yes. Abrotanum, yes. Merck and Tarantula, very good. Few rubrics which I'll go through. Okay. Desire to kill. Anger with impulse to kill. See, this is not only killing of the insects, but then What is that desire to kill? You cannot kill always a bigger animal, or you cannot kill a human being always. But then that desire to kill is there. And what do you kill? Because of that anger, you want to kill. But then whom can you kill? You will kill an insect. So that can be an acadium. That cruelty in the mind. What else? The impulse is there in the mind. Okay, it has not come out. Which are the medicines which have the impulse to kill? One remedy is Proteus. Anger with impulse to kill. Then sudden impulse to kill. Can you imagine? Sudden impulse to kill. What all the anger remedies are coming to your mind, right? Anger and sudden impulse to kill. Hepar, excellent, excellent. Hepar, then Merck, Tarantula, Lycinum, then even Platina, Naxomica, fluoric acid, Merck, Sufira is saying, yes, very good. Sulfur is there. Can you imagine? Chamomilla, Arsal, yes, these are all angry remedies. Chamomilla does not have I did not see that in the impulse to kill, but then in many rubrics it is there for anger rubrics. Then, in certain cases, what if the lady wants to kill her husband? There was a quarrel with the husband. This happens daily, no? Yes, it is Platina. Very good. Not only Platina, Naxomica and Merck are also there. They want to kill their husband. Then what if certain people want to kill anybody, but they want to kill a woman? They don't want to kill men. Yeah? Only one remedy in our repertory. Iodine. Monica, you nailed it. It is iodine. Can you imagine? And what if the mother wants to throw the child into fire, or throw the child out of the window, or she wants to kill her own child? Yes? Please type in, no? Typing will be better, I think. Hepar. Many of you are Archana is saying Hepar, Suresh is saying Hepar, Kyle Vidi Hepar, Monica Lycopodium, Kirti Sepia, Edil is saying Lycinum, very good. Nuha is saying Platina, Supera is saying Platina, Athira is saying Naxomica. Excellent. Platina is there. Then killing her own child is Platina, Merxol, Argentum nitricum, and Androctonus. Naxomica is not there. Yeah, yes, yes. How cruel it will be, no? All these things will be when they are insane. Yeah. But then at that moment, even though they are sane, at that spit of an anger, they are not able to control that anger, and they feel like an impulse to kill their own child. Oh my goodness. Then threatening to kill. There is no real killing, only threatening to kill. Out of anger, I'll kill everybody. Yes, what is that? Hepar sulf and tarantula. Hepar sulf and tarantula. And impulse to kill. Yes, Edil, tarantula is there. Yes. Impulse to kill with the slightest offense. If somebody is saying no to you, you have the impulse to kill. This happens, no? You have read newspapers, right? Every day you see there was a quarrel about dispute, about the property, about the house. There was a fight, and then somebody kills somebody. Yes, homicide happens. And after that they will cry and say, "Oh, why did I do this?" They did not have the intention to kill. Androctonus will have that planning, and then they will execute the action. Yeah, it is a real cruel remedy. Whereas these remedies need not be always cruel, but then at the height of their temper, they are not able to contain their anger. Which are they? At the slightest offense, Naxomica. Yes, Naxomica, Hepar, and Merck. These are the highest of anger remedies, no? Throw the child into fire was Hepar, sulf, Naxomica, Lysinum, iodine. Very good. All this, yeah, many doctors have said that. And recently in Kerala, we had a very bad, sad incident. Yes, Atira. Yeah, that was like, it was a house surgeon. She was serving in some district hospital or something. And then there came a drunkard. And then this girl had to examine along with other doctors. Suddenly, this drunkard became run amok. What is this run amok? Drunkards can be run amok, right? They will run and they can kill anybody. They can give fatal blows to anybody. So this is also an impulse. But then for drunkards, which is the remedy? Which is the remedy? Not Naxomica. Which is the remedy? It is not a, it is after, yes, after drinking. It is not so macabre. Desire to kill for in a drunkard. Desire to kill after having that alcoholism or yes, it is hyoscyamus, Nuha. Yes, Nuha, it is hyoscyamus. Run amok is hyoscyamus. Drunkenness during. Kill desire to drunkenness during. That is kill desire to everyone he sees. Whoever is in his way, he will without any bad thought, without any second thought in his mind, he will kill because he has already lost his mind. No, that is because of the effect of alcoholism. See how much all these drugs are causing damage to your thinking process. So now coming to our this child has all these things. He loves to play in mud and roll in mud and be dirty, and then he has got so much of anger that he has got that impulse to kill insects. How? Ruthlessly. Yes, or destructive things. Destructive, throwing away valuable things and being destructive. Even his love was violent. He would embrace his mother so violently that she would be almost suffocated. He demonstrated his love by pinching her cheeks and hurting her. Anger was precipitated suddenly. Anything he suggested which was contradicted, like wanting to watch a particular TV channel, he would straight away get up and throw anything like a vase on that person's face or give a box on the face, not bothering to see who the person was. How old is this child? 4.5, guys. What if this child grows into an adult? Yeah, not bothering to see who the person was. And he loves to watch violent action movies. See how violent this child is at 4.5 years of age. And the next sentence is, he's extremely restless child, could hardly sit in one place. And his memory was very sharp. Now, which medicine come to your mind? Restless child, extremely restless child. We have talked about many remedies which are having the rolling on the floor and which are having this severe sudden impulse of anger, kill difference and all that. What is the difference between impulse and kill desire? Suresh, yeah. So this impulse is what? Impulse is not a planned thing. Kill desire too, yes, it can be that this patient wants that desire is there. But then if it is only an impulse, this patient will be having that anxiety of conscience later on. After he has done that remorse and reproach and all will be there. If it is kill desire too, they don't have all those things. Impulse is only for that spur of that moment. Sufera is saying tarantula. Impulse is hysterical killing, desire is perversion of morals. Yes, Monica, thanks for the input. Yes, now the remedy tarantula comes to all of our mind, no? The child is extremely restless. And the parent said he picked up things very fast. He is quick in understanding. Fearlessness was marked. He would jump from any height. He can jump from swings, from steps of ladder, never cautious about getting hurt. But once he was hurt, he will take care of that injury immediately by applying ointments, etc. So there are two pictures, no, for this guy, for this small boy. So his mother said that he is very loving also. And we know that all his symptoms are going towards exhibition of violent anger. So opposites are there, no? Extremes are there. And even though he is a destructive person, he has got lot of love also. And here another thing came up now. Does not have any fear for getting hurt, but then once he was hurt, he will immediately take care of it also by applying ointments. Yes. So extremes are there. Which is the great remedy for extremes? Either this end or that end.
Work.
Merc, medorinum. Extremes. If you can see extremes, medorinum. Medorinum can exhibit lot of courage also. It can exhibit lot of timidity also. Not crocus, Suresh. Of course, crocus is a hysterical remedy. Anything can happen to crocus, right? Crocus has got great desire for dance and for music. And what about this small boy? He has got great love for animals. Love for animals. Extremely crazy about horses. He has one too. How many of you have horses in your family as pets? as domestic animals? How many of you rear horses in your family? Anybody who have a horse? Give me some indications, guys. Are you all sleeping? Rarely. Okay, so there is an option. Kayalvini is saying no. Yes, this was the answer I expected. No is the answer. What all pets do you have? What all pets will you keep in your home? Normally, dog, cat, dogs and cats. Yes, Kayalvini and Archana. Other than dogs and cats. Cow. Dr. Vishnuvardhan is saying, yes, cow as a domestic animal, we all had. Hamster. Archana, hamster. Cats and dogs and birds, Sukaira. Yes, Adira, cats and dogs and birds. Kayalvidi, hen, birds, fish. Very good. Now we are going to read this book. What are all his abnormal pets? Let us see. Horse is one abnormal pet, right? You never keep horse as a pet. But then, okay, people who are having this in Chennai, we have race course where the horses are used for business, no? There for the racing, they need that. Maybe if the child is in that family, he will be seeing a lot of horses in the lawn. Of animals at home, he has forced his parents to keep a horse, dogs, cats, ostrich. Yes, ostrich. Ostrich as a pet in the family. Can you imagine? Ostrich, hens and rabbits. Yes, rabbits also. Then turtle. Turtle, very rarely people have turtle. Maybe I don't know whether they keep it as a pet or suddenly it grows all of a sudden in a pond of a fish, no? A deer. How many of you have deer in your home as a domestic animal or as a pet? A cow. We all had lot of cows and hens and all in our ancestral house, no? And now he wants them to keep a tiger. See where his imagination is going on. Like Tipu Sultan. Tipu Sultan always had a cheetah by his side, right? He wants a tiger. And he is very affectionate towards bigger animals and very cruel towards insects. See how his dimag is going. He feeds all the animals by himself. Now, this shows clearly shows that this boy has got an enormous craze for animals. Which are the remedies coming to your mind? Love for animals. Sulfur, carcinosinum, Ethusa, carcinosinum, phosphorus, medorinum, pulsatilla. Very good. Yes. Ethusa. Come on, let us rule out this. Ethusa. What is love for animals? In Ethusa, this is not simple love for animal. It has some uniqueness, ma'am. So veratrum. Yeah. Okay. Ourself for love for horse. Okay. So now let us not be carried away by going behind horse or going behind deer or going behind turtle. How many all these things are there? How many uh, rare desires this boy has? Not only horse, no? Ours is for love for horse. Then we will have to take love for turtle also. We have to take love for ostrich also. We'll have to take love for deer also. Not possible, right? But then it all shows what? His syphilitic mind, his perverted mind, his pervert, that Archana said it rightly. That uniqueness, these are not simple love for animal, but this only shows the pervertness of his mind. That it only highlights syphilitic thing. So we want to take a highly syphilitic remedy. That is the only indication here. We cannot go behind animals. But then for sure, this child has got an affection for or a love for or a desire for keeping animals. That rubric we can take if we need to rule in or rule out. Ethusa, Ethusa is the only remedy which talks to animals. Talking to animals, only one remedy is there. That is Ethusa. Why he wants to grow this may help to get deeper into his genetic type, maybe, but then he is only 4.5 years old. Yeah. So we won't be able to have love for strong animals. Having love for strong animals, yes, very nice input, Shubhangi. And he has got contemptuousness towards insects, right? He has got that craze for strong animals and contemptuousness for he will be killing the insects. That is also seen in his personality trait. So this automatically shows that he is having a love for power, love for, yes, dominating others, anger and all that. At the same time, he is having somewhere weakness also. This is the reason for the highlight of being strong, being strong, being strong, and want to have a tiger and all that. So, Ambragracia, Beretta carp, Buforana, Calcarea. What is common in all these things? And they all have love for animals. Why? Yes, Archana, that is hard on inferior and soft on superior kind. Yes. So all these remedies like Ectusa, Ambragracia, Beretta carp, Buforana, Calcarea, all these things have, then phosphorus also. No, phosphorus not to that extent. All these things have love for animal. What is common in all these things? Why do all these remedies have a love for animal? What is the sensitivity there? All these remedies are bashful, right? They are all timid. So they cannot interact with people just like that. They cannot go and interact out into the world like a lachesis. They will be always put down by others. Whereas they are they are having this unconditional love towards animals. Animals will never put us down, no? They are mild, yes, Shubhangi. And Ethusa will talk to the animals also. So carcinosinum, they're already dominated at home. There is nobody to vent out. And this always they have to go up to the expectations of their parents or the teachers, to the human beings, to the neighbors, to the uncles, aunties. Always they have to mold themselves. They are tired of molding themselves. What about the animals? The animals never ask you to mold anything, guys. Animals simply love you unconditionally, right? That is the reason why we want a pet, okay? So this carcinosinum that is the reason for carcinosinum to have a pet always. Then lac delphinum, lac felinum, and lac leoninum. I'm not thorough with lac thing, but then this lac, all these things are mammals, no? Milk of mammals. So they always have the love for animals. And milk is also an expression of love, right? So now coming to medorinum and natramure. See this medorinum and natramure, what is the interest for them in love for animals? Medorinum and natrum always have love towards not to all the animals, but then to their own pets. Love for their own pet only. Natramure, it will not go and play with any cats or dogs on the street and all. It will not go. It will not feel that sympathy, or it will not go and play with pets and all. That one-to-one love, exactly, Archana. This one-to-one love that is exhibited by Medorinum also towards its own pet, and to Natramure, that is very famous. You all know that. Then phosphorus, sorinum, pulsatilla, sulfur, tarantula all have this love for animals. Yes, Shubhangi, they will not emotionally hurt you, whereas they will always be venting you out. Even if you show your anger towards them, they will never show their anger towards us, right? They will only give back love to us. But then this child is a totally different child, right? It can hit his pets or whatever. No, he shows lot of anger. Horses fascinate him. Even on sitting on a swing, he used to gesture as if riding a horse, right? And egoistic remedy. He is highly egoistic. This sorry word, the word called sorry, does not exist in his dictionary. Yes, very egoistic. And he hits with head. He is very moody. He will listen to parents only when his moods allow. Usually does exactly opposite of what he is told. See how much defiant this boy is. Hits with head. Now come on, striking head and all. Which are the remedies coming to your mind? Striking his head, striking in children. Which are the remedies coming to your mind? All these striking children, hitting children. Belladonna, yes. Tuberculinum tarantula, yes, very good. Chamomilla sina also. Lycopodium also. Yes. Naxomica, opium. Again, tarantula, very good. Yes. Tuberculinum, syphilinum, all these remedies are there, no? Hitting with head. What else? He has got a habit of putting collar in the mouth. Now come on. Putting collar in the mouth. Hyoscyamus, tarantula, tarantula. Yes, Archana and Atira. Shubhangi also. Tarantula is the tarantula, and one more medicine is there. That is plumbum. Never heard of, no? Tarantula, everybody is thorough with. and he is a braggart and a liar. Which are the liar medicines in our materia medica? See how much personality traits we are dealing in homeopathy. Liar medicines, opium, very good. Hyoscyamus and drug remedies, no? Like lachesis. If hyoscyamus is there, liar, morphinum, opium, veratrum, syphilinum, lachesis, yes. Sulfur, platina, naxomica, lycopodium, medorinum, all these remedies are there. They are all liars. Now. The more he is praised, better is his input. Things he is interested in, he does fast. And what he is not interested in, he will do it slowly. Not much interested in music, but he wants music on continuously in the car. So now we go to the next paragraph. Sometimes he tells his mother to sing with room closed and dances alone for hours. He dances also for hours together, guys. So what is this dancing? Which are the medicines coming to your mind with dance? Tarantula, yes. For what beats? Fast beats, no? Tarantula, yes, jazz beats. Then carcinosinum, loud music, Shubhangi, yes, for tarantula. Elapse is a passionate dancer. Carcinosinum is a graceful dancer. Ignatia and Sepia, dancing ameliorates. Tarantula, again, fast moving. Sepia, yes, dancing ameliorates. Durga Devi, thank you. Then Archana, yes, Sepia, yes. Sepia, amelioration with dance, no? Okay, dancing alone for hours. Yes, Monica. He will never dance in front of others at all. Now, this is the $1,000,000 question. He will never dance in front of others. He is a so-called violent and courageous, angry, confident person, not defiant. But he cannot dance in front of others, guys. He will ask his mother to sing and he will dance and dance and dance for hours. What is this constitution? Why? He does not want people to criticize him. He is that egoistic, hysterically egoistic. There are certain girls and boys, no, who will roll on the ground by just saying no or by just giving a look. There was a small child who came here along with his mom, and then he was always making faces and showing that uncomfortable face and all, no, like does not like this place, etc. And he was constantly nagging also. So I just gave him a look. Why did I do that? I want to understand what this personality is. To cut short my case taking time, I just gave him an angry look. Hey guy, you be quiet. Just like that, I gave him a body language, a strict body language. Immediately, he started crying and howling and rolling on the floor and behaving hysterically. I gave him Moscas 1M and he got cured very well. He was having a very bad allergic rhinitis complaint. It was kind of obstinate allergic rhinitis. It was not getting under control at all. With Moscas one dose, that hysteria part went off. And this excessive reaction. What is allergic rhinitis? That is again excessive reaction. No, all allergies are hypersensitivity reactions. So that hypersensitivity is gone, and this child physically also that showed. So here, if anybody criticized him or said bad about him, he would be so hurt that he would roll on the floor, kicking, weeping, shrieking, and screaming, just like Moscas only. Hysterical behavior. But what is this? How can you convert this into rubric? He cannot take anybody talking bad about him. What is the rubric? He cannot take anybody criticizing him. Rubric? What can be the rubric? Anybody telling bad about me, I just cannot bear it. I am afraid that others can say bad about me. Others offended easily. Excellent. Offended easily, Adira. Sensitive to criticism, opinion of others, delusion criticized, sensitivity to criticize. Excellent, excellent, excellent. His sensitivity was marked not only towards himself, but also towards his pets. He will go and kick his pets, no? With all this destructive anger and sensitivity, he will go and attack his pets. He is very restless and he is high strung. He is startled easily on being called suddenly or due to a sudden loud noise. He was also kind-hearted, as his mother puts in. He could not bear to hear about cruelty to animals, or he could not see a man or animal dying, even in movies. So this sensitivity is also there, and exhibition of violent anger is also there in this child. So now coming to the personal history, yes. What about his appetite? Are we good to go? Is this case interesting? Yes. Give me some thumbs up or something. Good, na? Yes, Sufaira, Monica, Atira. Yes, thank you, guys. So you are all now curious, no? What medicine this could be? Even I am curious whether it is Merck, whether it is Tarantula, whether it is Moscus, whether it is sulfur, opium. Yeah, it can be anything, no? Depends upon moods. Appetite depends upon moods. He might feel hungry suddenly or not eat at all for days. Again, this is going to extremes, right? Suddenly he is very hungry and for days together he will not eat at all. So this extremes is really there in this case. Thirst on the higher side. He loves to have curds, soup, sweets, chocolates and ice creams. Bowels, he is having a constipation. Sleep is less but refreshing. He wakes up fresh. Dreams, nil. Now let us go to the origin, duration and progress. Now you have to give me the inputs, okay dears? After the first vaccine at the age of 1 year, the child developed mild rash on the face treated with local ointments. Now what is this mild rash? Mild rash means which miasm and which layer. This is how we enter into the case. Otherwise, it can be any medicine like opium, Merck, Medorinum, Tarantula, Moscus. It can be any medicine. We don't want to tackle this through the knowledge of materia medica. We want to go step by the mathematical equations. Excellent, all doctors. It is ectoderm. It is first layer, soric. Very good. Then what happened? It was treated with local ointments. You know, it is getting suppressed. After that, yes, Soumya, yes. After that, mild cough started. Now get ready. What is this cough? Which miasm? Sora ectoderm. Yes, mild cough. Excellent, Soumya. Mild cough is again Sora. It can be ectoderm. If it is a pharyngeal cough, it can be ectoderm. Or if it is little deeper, yes, LVD, it can be the second layer, no? Endoderm and soric miasm. Then, second vaccination of hepatitis was given, which was followed by loose motions. Now, loose motion. Loose motion is which layer and which miasm? Loose motion. Second layer, Sora, Aishwarya, Kayalvidi, Edil, yes. Second layer, soric miasm. Because there is no blood or mucus and all in the stools. It is only loose motion. Then the next thing is, loose motions were treated with some local homeopathic remedies and voice started becoming hoarse on and off. Now, which layer, which miasm? Voice. Hoarseness of voice on and off. Hoarseness of voice. Second layer, it is not second layer. And it is not psychosis. It is third layer. Why? Hoarseness of voice means it is the cartilage. It is the larynx. Very good, Durga Devi, Kayalvidi, Sai Narendra, Kayalvidi. Yes. Huh? So it is the cartilage getting affected means it is the layer 3. And what miasm it is? It is not psychotic miasm. It is on and off. Hoarseness is there for 2 days, then hoarseness is not there. Again, hoarseness is coming, but lot of dynamism is there. Dynamism means which remedy? Which miasm? Soric. So it is soric and it is still in the soric only. It is still in the soric layer, soric miasm only, but then the layer is the third layer. Then what happened? After the third vaccination, at 1.5 years of age, the voice became completely hoarse. Now the miasm has changed. The gear has changed to psychotic miasm. The voice became completely hoarse. Means what? Layer 3, but psychotic miasm. Or it is even going towards syphilis. No, completely hoarse means what? It is aphonia, right? This was followed by severe violent spasmodic coughing, which was first periodic and later after treatment became a daily affair. Now, where is this going to? Which miasm this is going to? Sora is over. It is now coming into psychosis and it is coming to syphilis. Yes, Kailvidi. It is going towards syphilis. Why? Because even though the child is having only so small, small age, that is 4.5 age only, the child is, the trait of child is a syphilitic predominant trait, right? That is why it is easily going with every suppression, it is jumping the layers, and with every suppression, it is slowly going, it is immediately going into 4.5 years only, and still it is exhibiting syphilitic trait. Now let us go into the syphilitic genitive trait at mental followed by physical. Exactly. Journey of disease. Yes, Sai Narendra. Thank you. In the above case, disease initiated or precipitated by vaccine, that is the first layer in the form of disturbed immunity expressed itself and traveled as inflammation. Closely follow me, okay? I don't want to read this again and again, just closely follow me. It traveled as inflammation, right? The injection, the vaccination given on the skin, abrupt that caused that disturb of immunity there upon the skin and is traveled as inflammation, that is sora, from the skin to the mucous membrane of the pharynx and trachea, causing the cough. Further, it went to GIT, and in the intestines, the inflammation gave soreness and sensitiveness. Both soreness and sensitiveness are soric manifestations to give rise to diarrhea. That is the second layer, endoderm. From here, the inflammatory process of sora traveled to the third layer, that is the connective tissue layer, and affected the laryngeal cartilage. Yes, this hoarseness would come and go. Okay, it is dynamic. Since the laryngeal cords were now and then getting irritated and inflamed. Irritation and inflammation are nothing but sora by whatever irritant like cold air, cold water, dust, pollution, etc. So this was a soric state of hoarseness. As is well known, every irritation is followed by induration or thickening. Yes, this induration or thickening is nothing but the psychosis miasm. No, when this thickening or induration occurs, the inflammatory stage is over. That is, sora stage is over, and growth stage, that is psychosis stage, starts. Thus, sora or inflammatory manifestation in a particular cell, tissue, or organ. Here it is the laryngeal cartilage or the vocal cords, after having warned the person, often by dynamic symptoms, that is changeable, reversible symptoms, now decides to settle permanently in that organ in the form of a growth or induration, which we call as psychosis. I hope you all have understood this. This is dangerous state where the individual's constitution starts showing various signs of, which are all the signs? That is increase in weight, no? Signs of psychosis, increase in weight, rounding of the previously sharp features, example, nose, eyes, contours of face, etc. Along that is the physical changes, roundness of the body, plus dullness, slowness, deceitfulness, hiding tendency, vanity, etc. start manifesting in the behavior and attitudes. So mentally and physically, the child is now changed into the psychotic miasm. Performances in the school is affected. The child, always running around, restless child, is now becoming lazy. Any exercise becomes laborious, and a young active boy may also develop dyspnea, a preliminary hypertensive symptom. Yes, clearly from the sora, it has gone into the psychosis. This stage is traveled from sora to psychosis. In the above case, the voice became permanently hoarse due to induration of nodes after the third vaccination, and travel from psychosis to syphilis. Induration of nodes is nothing but psychosis, but in total aphonia, total loss of voice will be syphilis. The hoarseness had now become permanent. That is the syphilis thing. It was treated with different medicines with no avail. Now the inflammation on the cartilage was psychotic inflammation. The advent of violent, out of proportion, devastating coughing bouts was an indication that the disease was threatening to progress from psychosis to syphilis. Yes, syphilis is destruction. We saw many destructive mental rubrics here. Perversion, yes, we saw. Abnormal, distortion, yes. Who will rare, rare an ostrich or a deer and all. Perversion, distortion. Ordinary bronchitis or soric bronchitis does not give to violent cough, which affect the whole economy. Periodical monthly cough was pre-syphilitic stage. What is periodicity? Periodicity again points to syphilis, no? It comes sharp at the same hour. Which is the remedy? Again and again it comes back. The complaint comes back sharp at the same hour and same minute. Lactasis has periodicity, annual periodicity or alternate months, etc. At the sharp, yes, it is Cedron, Durga Devi. Adira. Yes, it is Cedron. Arsalb also is a great periodicity medicine. Yes, Soumya, it's Cedron. Delirium periodical. Periodical. Yes. But this one is periodicity. Periodical means what? But then that is delirium paroxysmal. Yeah, delirium periodical. I'm not sure of that rubric, guys. China, Sumant Reddy, good input. China is also a periodicity remedy, no? In the malaria itself, you can see that thing, no, coming up. So now in paroxysms, China, paroxysmally the fever comes, then the sweat comes, then the chill comes, the rigor comes, again the whole cycle starts, that is paroxysm. But China is a great medicine for periodicity. So here it shows that the gear is already shifted to the syphilitic miasm. 3 more minutes, okay, guys? Where the disease was threatening to travel from psychosis to syphilis. The more the cough was suppressed with allopathy and partially indicated homeopathic remedies, the more vigorously it boomeranged. That is Newton's second law of action. Every action has an equal and opposite reaction. So once the syphilitic cough set in, that is coming on only at night. Yes, only at night, syphilitic. Violence-filled coughing, syphilitic bout, giving rise to suffocative spasm, again syphilitic. The child started on other destructive trait like loss of weight. Physically also he started showing loss of weight and his nature becoming unduly harsh, mentally also unduly harsh, obstinate and cruel. Okay. So we go to the analysis for the first 3 lines only, and after that we will give chance to the doctor who is presenting the case today. Analysis, because this much we have already discussed. At the onset, so many remedies came to our mind. Yes? Correct? Archana, that's an input. Delirium periodical, belladonna, stramonium, etc. Yeah. Okay, good. So many remedies came to our mind, right? The destructiveness, restlessness, dancing, eating indigestible clothes points to tarantula hispania. Yes, we all had a notion that whether this could be tarantula. Then the revolting, angry, restless with indifference to reprimands point to Baghdad, defiancy and all, that shows it can be murk, no? Then the love for animal with hatred, destructiveness, and restlessness may point to medorinum, and the extremes of opposite conditions and all can be medorinum. We had all these medicines with us, no? In our thinking process. Now there is lots to read that we will go with before the proper rubric selection comes in, lots to read. So I think we will stop here for today.